Hi, welcome to Case of the Day. Today is the 34th staging AVN of the femoral head. So, this is a 77-year-old known to have long-standing angstpon presented with aggravated stiffness of the lower back. And when we looked at his old papers, there was an MR of the spine but screening to the hips describing a stage 2A AVN without marrow edema or collapse. So here on the stir you can see a little bit of scar, no marrow edema. The contours are maintained. Little scar on the T1, and when we look at the double oblique axial, coronal, and sagittal, you can see the crescentic scar. This is classic avascular necrosis, but you can see the border, the normal marrow between the scar and the articular surface, and this is just an old healed lesion, probably occurred many years even prior to 2015. And we would actually call this an incidental finding, and it's just quiescent old healed AVN. But my colleague staged it as 2A, and my question was whether you need to stage such lesions at all. So, what's the staging? These are the various systems. Ficat is the one that we use in India. I asked ChatGPT to give me a table, and this is the standard table. When we have stage 4 disease, and that's when we have osteoarthrosis, then basically that means the patient will go in for total hip replacement. At around 2B, and sometimes even with 3, you would do a core decompression, and that's pretty much it. So this was a stage 1 lesion that I had, 3-day-old pain, and you see the subtle crescentic lesion, marrow edema, effusion, no collapse, no fragmentation, and the x-ray was normal. 2 is when we see an obvious abnormality, but the contours are maintained, and you may see sclerosis and some cystic change on the x-ray. This is a path slide that I had borrowed from the site, and this was actually quite about 8 or 9 years ago when I gave this talk. And you can see the crescentic area here, contour maintained. But stage 3 is when we start seeing a fracture, a subchondral collapse, and you can see the collapse here. But the cartilage is now maintained. There's no AVN, so you know that this is really just, this is not the same patient. I've just borrowed a path slide. And again, here you have flattening, a little bit of fragmentation, and the cartilage is maintained, so it's stage 3. And stage 4 is when there's cartilage thinning, large osteophytes, contour abnormalities. This is very obvious here as well. These patients will basically go in for a total hip. So staging AVN of the femoral head is quite simple and should be done using the Ficat system. But what my question still doesn't get answered is to whether old quiescent disease like the one we had or just a scar should be even given a stage. And I wouldn't have. I would just call it old quiescent scar from a prior insult. But it does theoretically fit into stage 2A. And so I guess both of those would be fine. Perhaps in the future, another day, I will look at differentials of AVN and how to diagnose it and differentiate it from other similar entities. But today, the whole issue was just about staging AVN. That's the WhatsApp channel, and thank you so much for viewing this.